What is diabetes? So diabetes is a condition where our body loses its ability to regulate blood sugar correctly. An example is when after we eat a meal, our blood sugar goes up, and then with the help of insulin, it goes back down again. So temporary elevated blood sugar is not a bad thing. In fact, that's what occurs in our daily function. But with diabetes, our blood sugar is chronically elevated, and there is a downside to that. High blood sugar will start to bind to certain things where it doesn't need to and cause a lot of damage throughout our entire body. And we'll definitely talk more in depth about that later on down in the video. So there's many types of diabetes, and we're going to go over all of them, but we're going to focus on the most common ones that we see nowadays. So there's type 1 diabetes, and type 1 diabetes is called autoimmune, or is also known as insulin dependent. And it's when our body, for some unknown reason, starts to attack the beta cells that's located in our pancreas that actually produces this insulin. And over time, our body can't produce insulin. So we have nothing to drive the glucose into the cells. So our cells are literally starving. And type 1 diabetics, for the most part, if they don't have insulin, you'll see them being very skinny and very frail. And if they don't have an external insulin source or exogenous insulin, then they will die. This is why insulin for type 1 is so crucial. It is the main differentiating factor between type 1 and type 2. The second type of diabetes is type 2 diabetes. And type 2 diabetes is the most common one and accounts for about 90% of the cases of diabetes. It's also called insulin independent because you don't need insulin in order to survive. You can take other medications to lower that blood sugar. But over time, if it gets too severe, people with type 2 diabetes can use insulin in order to drive down their glucose levels. Type 2 diabetes, for some reason, the receptors and the insulin itself, there's a malfunction. So it's not allowing insulin to do its job properly to allow that glucose to come in. So type 2 diabetes is also known as insulin resistance, and that's the main differentiating thing between type 1 and type 2. So type 1 is insulin dependent and type 2 is insulin resistant. So the next type of diabetes is gestational diabetes, and this occurs when we're pregnant. And it's because of the hormonal imbalance that occurs when we're pregnant, it's unable to regulate blood sugar like it should. Insulin, for some reason, is not working properly, and so we have this elevated blood sugar. Gestational diabetes is not considered or categorized as a chronic progressive disease because for most of the time it reverses back on its own. However, it does put you at a higher risk of diabetes later on. To understand type 2 diabetes and how it develops in our body, we have to understand how sugar, or another name for it, glucose, is metabolized in our body. Glucose is a carbohydrate, and a carbohydrate is one of the 3 macromolecules that we consume for energy. Most of our cells use main glucose as an energy source, but there's other cells in our body like our liver, heart, and our brain are able to use other energy source to survive. If glucose is depleted, our body will start to switch to ketosis, which just means it's producing ketones to use as an energy source. But you really don't want to rely on that too long because it does have negative side effects. So glucose is essential and vital for our survival. Just think of it as gasoline for your car. Without the gasoline, we're not able to drive that car anywhere. And so that's why it's so crucial for us to maintain that sugar level and make sure that it's not too low or too high. Why high blood sugar for a long period of time is not good and can affect the whole entire body. So when we have elevated blood sugar, it triggers a lot of different processes that can be very damaging to the inner lining of our blood vessels, also called the endothelium. Elevated blood sugar causes increase in oxidative stress, promote inflammation, and decrease the elasticity of blood vessels. Glycation just means that it tends to bind to pretty much everything in our body. Nucleic acid, proteins, fats, and by binding to these, it really impairs it from working correctly. Oxidative stress creates compounds that are very reactive that can also create more damages to the endothelium. Inflammation really affects the blood vessels in a lot of different ways. It can decrease the insulin sensitivity, and it can also cause more damage to the endothelium. And the reason why we need to understand this is because damages to these blood vessels is very important in our overall health, because these blood vessels not only carry important nutrients and oxygen to our cells and organs in order for it to survive, but also taking away the waste and other things away from the tissue. And when you cut off these supplies, our organ can be drastically affected by it. So based off the size of our blood vessels, these complications can be divided into microvascular complications or macrovascular complications. Microvascular complications affects the small blood vessels that supply nutrients to our eyes, our kidneys, and our nerves. And so if the blood sugar is not corrected or not treated, then over time it can lead to retinopathy, kidney disease, or loss in nerve functions. And so sometimes you hear diabetics complaining that their vision is blurry or that they're going blind from it. They have kidney disease. Or another common one is losing sensation in their extremities because their nerves are affected. Macro complication refers to damages to the large blood vessels that supplies nutrients to our hearts, our brain, and our extremities. So if the blood sugar is not corrected, then this can lead to heart attack, stroke, or circulation issues, sometimes leading to amputations of the limbs. I hope you enjoyed the video and found some of the information covered in this video helpful. If there's a topic or something that you want to learn about, leave it in the comment section and I'll try to do a video on it for you guys, okay? Appreciate y'all.